Sure.
Hi, on this 77th Independence Day, we welcome to this unique hair care initiative by IPCA. I'm Mona Sharma and it's my pleasure to be your host today. This unique initiative seeks to provide expert advice for various issues connected with hair care. Our hair is a crowning glory and it makes a world of difference to our appearance. However, our hair also requires special care and attention. Earlier, it used to be a sign of middle-age problem when you used to lose hair or have thinning of hair or bald patchy hair. However, with increasing pollution and the increase of stress in our daily work life, we are now seeing hair problems occurring even at a younger age. It is not uncommon now to see 25 to 35 years old people having hair problems. Most of these problems, if identified early, can be managed well and much of the hair loss can be avoided. Today, we have with us Dr. Imran Wali, is a well-known doctor and has been practicing as dermatologist in West Bengal for over many years now. Dr. Imran Wali has dedicated his career to diagnosing and treating a wide range of skin and hair conditions while providing personalized healthcare services to his patient. He takes time to listen to his patient concern and work closely with them to develop a treatment plan that meets their individual requirement. He can speak Bangla, Hindi, and English to each patient in a way that makes them feel comfortable. He is currently practicing at Dr. Wali's General Clinic, Salt Lake City, Kolkata, West Bengal. Dr. Imran Wali is aware of the need for the patient awareness and education about hair care and spends a lot of time in giving talks at various platforms across the country. Thank you, Dr. Imran Wali, for sparing your valuable time to answer a few questions on hair care for us today. Welcome to the show.
Thank you. Thank you very much for your wonderful introduction and wish all the viewers and everyone and you a very, very happy 77th Independence Day. And it's a very auspicious day. And I would like to start with a very important thing, which, as she said, the crowning glory of the body, which is the hair. Now, the most important thing is about the hair. Will you give the question or shall I stay?
Yes, doctor. So first of all, थैंक यू सो मच हमारे साथ जुड़ने के लिए। तो आज तो हमारा टॉपिक जो है वो रोल ऑफ विटामिन्स एंड मिनरल्स इन हेयर मैनेजमेंट है। तो जब हम हेयर लॉस की बात करते हैं, व्हेनेवर वी आर टॉकिंग अबाउट हेयर, द मोस्ट कॉमन प्रॉब्लम इज द हेयर लॉस। सो डॉक्टर, व्हाट्स नॉर्मल एंड व्हेन टू बी कंसर्न फॉर?
ओके जी, सी देखिए मेरे पास जब आते हैं सब, people are concerned because they're really concerned about hair. As I told you, it's like an ornament that you wear jewelry, and nowadays, as you said, that because of a lot of stress and all. See, hair fall is nothing to be alarmed about, provided आप सही जगह में सही वक्त में आप जाते हैं. That's very important, and that is to the dermatologist or the trichologist. आपको बाल गिरे, there will be 20, 25, 30 hair falls over. That is also a lot of factors. हम लोग जब आते हैं मेरे पास, what we do, हम लोग जो स्टडी करते हैं, if there is any deficiency, जैसे कि कोई प्रॉब्लम है, थायराइड प्रॉब्लम और डायबिटीज है और इम्यूनो कॉम्प्रोमाइज है, ओके, फर्स्ट काउंसलिंग वेरी इंपॉर्टेंट है टू काउंसल द पेशेंट। आपको भी पता है, सबको भी पता है, इट इज अ जेनेटिक थिंग, हेयर फॉल इज अ जेनेटिक थिंग। एंड हेयर फॉल में जो बोलता है ना, जो वॉल्यूम या थिकनेस, किसी का वो सब होता नहीं, वॉल्यूम थिकनेस बोल के कुछ नहीं है। द मेन थिंग इज, if you have thick hair growing till you die, you will have thick hair growing. You might have reduced hair, but you will have that thickness. It is not that you plant a seed and it becomes a huge banyan tree. You understand? Your hair fall will grow whatever the way it is, both for girls and for boys. For girls, their hormonal imbalances take place, menstrual imbalances, the hormonal imbalances, and for the gents also, for the boys also. And we always try to first emphasize on the counseling part of the hair fall. There is nothing to be alarmed with. There are various types of hair falls. One is, see, I don't want to go into the nitty-gritties. When the patient comes, the patient wants results and explanation of how to go about it so that the patient doesn't press the panic button. Okay. So now hair fall can be lots of things. It can be angular hair fall. It can be alopecia areata. They can be trichotical, your trichotillomania, which is called the one particular hair fall because of stress related. If you do a lot of experimentations with your hair, that if you do a lot of, if you're heating your hair or you're straightening your hair, these things causes a lot of damage. I always emphasize, I'm always bolte, proper diet, food is very important. The food a person takes is ultimately very important for the hair, for the luster, for the glow, for the glamour of the hair. And of course, exercise, proper sleep, these plays a very important role. You always experiment with your hair using a lot of chemicals and this and that. It's not going to work well for the hair. And because nowadays even everyone is working, so you must take care of your hair. You must shampoo your hair regularly. You can, if you want, you can oil, but then shampoo. You cannot oil and keep it for a long time. You might have eruptions. And so these are the main things. And you always try to gently brush your. So these are the things by which you have to understand, and you come when you come to the doctor.
Okay. So, doctor, like you have told us that we are having bad lifestyle, and because of that also we face hair problems. So other than the lifestyle, what are like general causes of hair loss?
See, it's a good question. The general causes, as I told you before, it could be a thyroid problem, it could be diabetes, immunocompromised patient. You can have a fungal problem in your scalp. You can have a bacterial problem in your scalp. You can have a lot of autoimmune disorders like DLE, etc. You understand what I'm saying? This called lupus. You must have patches on the scalp. So these are psoriasis or pseudo-psoriasis. These are the factors which can trigger the fall of hair. So you have to first control the root cause and then reduce your fall of hair. You cannot stop fall of hair. You can always reduce your fall of hair. That is very, very important.
Okay, doctor. So, doctor, can you please enlighten us some, like, what are the medical options available for hair loss, like topical or surgical or non-surgical, or are there some oral also we can take and, manage our hair loss?
Correct. Now, see, I'll tell you, I am a classical dermatologist, the old school dermatologist. When the patient comes to me, I see and I search for the root cause of the problem. After I see the root cause of the problem, we can give oral medicine. There are lots of oral medicines, you know, available now by the pharma companies, and also lotions, topical lotions, by which we try to address the hair problem. If there's a problem called alopecia areata, where we give injections on that particular area, 2-3 sittings. And of course, if the patient is totally bald or patient is absolutely desperate to, then there's the next thing which is hair transplant, or there are various new things, is PRP. Those are the kind of things. So we have to first see, actually, if you come in the right time, if you don't waste time, I don't think you have to go to that extreme level. I mean, you can solve it before you go to the, it's just like, suppose a patient comes to you with a 4th grade cancer. I mean, it's very difficult, no matter what you are and no matter where you are. So the awareness, I always emphasize one thing which I must tell you on the awareness, and also the main thing is to go to the proper doctor concerned. That is the dermatologist or the trichologist. At least you can get the proper counseling for which you can do something instead of going to some misinformation. And nowadays, there are lots of plethora of huge volume of misinformation all in the medias and everywhere. So it is better to go to the person concerned for your advice to take care of the hair. Yeah.
So, doctor, like there are so many treatment option available we can manage, and also there is one word called nutraceutical, which is like nowadays very common to
Yes.
No, so can you please enlighten us what is nutraceutical and what
Yes,
is the
there are a lot of nutraceuticals which are very good for the hairs. Zinc is there. In fact, your company also has a lot of vitamins which has a lot of zinc and magnesium and biotin. They play a very important role. As I told you again, coming back to that, with these nutraceuticals, you will always have to have a very good diet. So if you can take this, it definitely reduces and retards the fall of hair. It will not stop, but it does retard. And provided you also search for the other causes of hair fall for both the males and the females. And as I told you, to add on to this, stress causes a lot of hair fall. Bad lifestyle causes a lot of hair fall. Excessive smoking and excessive things which is not good for your health will also cause a lot of hair fall. And also experimentation with your hair. You just have you can't play around with your hair. You have to respect your hair so that the hair respects you. That's very important.
Yes, doctor. So, doctor, like you said, stress is very is one of the reasons. So, can you please little enlighten us about how the stress impact our hair health?
See, not proper sleeping few hours, having excessive, a lot of caffeine, you're not having, you don't take care of your hair, you don't shampoo your hair properly, you don't brush your hair properly. So these are all factors which play together. It's not just one factor. There's a lot of compounded factor which causes a problem of your hair fall. But definitely stress definitely plays. Bad lifestyle, food habits, excessive it ultimately comes back to, because what you throw in the ocean, it comes back to you.
Yes.
So it's like that. What you give it to your body, body gives it back to you, good or bad.
Yes, doctor. So, doctor, can you?
Good lifestyle is very important.
Yes.
Unless it is genetic. I mean, there are certain things which it is not in your hand, not in my hand. Just like in cancer or heart problems or diabetes. So, but you can control it, right?
Yes.
So that's it.
So, doctor, can you please give us some important tips for healthy hair?
Yes. First thing is tips for healthy hair, as I told you, is proper food habits. Then there are a lot of nutraceuticals which are in the market which you can take under the consultation, under the supervision of the consultant trichologist or the dermatologist. Very important. Then healthy lifestyle is very important, proper food habit, proper sleep. These are very important things for your hair. Like, see, I have hair, but it is genetic. I mean, I hope till I stay, I will have this hair because it's genetic. My father also had the same hair. So there are certain things which is beyond our thing. But then you have to respect. And shampooing does not accelerate or cause hair fall. Trust me. I have a bath twice, I shampoo twice. So I'm not having a, that's a wrong phenomenon. Whatever hair is will fall, will fall. You cannot stop that. But shampooing is just to clean your hair, or oiling is just to keep your hair in a set pattern. To set it. If your hair is very curly, or if your hair is, it always very light and it grows, so you can set it. But it's that's about it. But in our pollution kind of thing, I would always advise you to have a mix and match of these things. So ultimately, you have to respect your hair so that your hair respects you.
Yes, doctor. So, like you said, we need to respect our hair so that our hair respect us. So, can you please also let us know, like when we have hair problems or any kind of hair loss, whom should we consult, like for the hair problems?
You have to consult dermatologist for the hair problem. I mean, if I have diabetes, I'm going to consult the diabetologist, not the psychiatrist. So it's the same way. If I have a hair problem, I'll consult the dermatologist, the certified dermatologist. So these are the things. People still see. What do I tell you? Excessive uh, boom of misinformation. I really don't know. When I get all these patients, they applied. I have got patients who applied so many vegetables on their scalp. I mean, vegetables, I guess, are there to eat. No? You shouldn't apply it and waste it on your scalp. And you can't apply things on your scalp for your hair to grow. You understand? I mean, someone tells them this. See, the point is, you know what? People get misguided. And if people get misguided, it's a big problem for us to bring it back to start the treatment in a proper way. You understand what I'm saying? Because it takes time. I mean, definitely, see, this was not 30 years down the line. See, I'm practicing 30 years. So when I started my practice, if there was a problem, they would go to the concerned doctor. Not like now you search for something, you search in this thing, and then you go experiment, then damage your hair, and then come running. I have had, I mean, extremely, educated people having doing such wrong things on the scalp just because they get some information somewhere. So these are all very important things for us to keep in mind and bear in mind and we can counsel the patient, so that they can next time, and I hope that they convey to the other people, so this kind of damage is not there.
Okay, so this discussion was very informative. I'm sure our viewers would be benefited by it. So, Doctor, can we ask some live questions from the audience?
Yes, yes.
So there is okay. The first question from our live audience is, Doctor, my wife knowingly, unknowingly pull her hair, and when I ask her why she's doing it, she say I don't know, and then it is because of that she has a lot of hair loss. So is it because of what? Is it a health problem?
Yes, it is definitely a hair problem. Pulling your hair out is definitely a health problem. It is, see, I have not seen, and this is a question which I'm just answering, but I'm trying to get as much clear as possible to our esteemed questionnaire, to our esteemed viewer. See, there is a problem called trichotillomania. If you are under a lot of stress, especially I've seen in patients with exams and students and all, they pull out hair of an accessible part of the scalp. They don't pull out hair on the back of the scalp. Accessible parts means the front or the sides or whatever. Where is the accessible? And they pull it out. So that has to be stopped, and they have to simultaneously do counseling and also treatment by the dermatologist, and it will be all right. And I always, another thing which I must tell you is I always emphasize some form of exercise or yoga, which increases your health and improves your immunity. So I don't think there's nothing to worry about. A proper counseling come dermatologist, I think we should do the trick. Yeah, there's nothing to worry about. It will come back, provided she doesn't keep on pulling it. Yeah.
Okay. Another question from our viewer is, Doctor, my daughter is 12 years old and she's have a gray hair. Why she have a gray hair? Is it because of some genetic reason?
See, first of all, this gray hair is a misnomer. Just like if you have a shirt, the shirt doesn't become small, you become big. The shirt is same. It's the same thing. It is actually a white hair, because that one particular layer of the pigment is not coming out there. It's a genetic thing. There's nothing much you can do. There are medicines, but there's nothing much you can do about it, as long as you have a healthy diet and you have a lot of these nutraceuticals, which can also retard this graying, so-called graying of the hair or the whitening of the hair. And
Doctor, you are mute. Please, can you unmute yourself? Yeah, now yes, Doctor. Okay. Another question is, I'll quickly take two more questions because we are running out of time. So another very interesting question, Doctor, because this we also face, like, there are we were asked that there are a lot of products on the internet. Which one is good for hair loss, Doctor?
See, why should you go to the internet? Why can't you go to the doctor? What is the problem? You must go to the doctor. There are lots of problems. They claim the Eiffel Tower. They claim, that you will have hair till from here to Timbuktu. Will that happen? So you should go to the doctor concerned instead of all these things. There will be people who will be selling their product. But as long as you don't get conned into it, and as long as the product is medical, you understand what I'm saying? So how do you see see, I'll tell you this. Now you're a doctor, right? Yeah. So now if I have a problem, I'll go to you instead of going to some other, you can at least guide me for the second step. So why should I go carried by whatever the products are there? The doctor will decide what I have to do, what you have to do, what extra XYZ will do. So that's the way it happens. Just because I'm getting in my hand, in my mobile, anything which I can then surf and I apply it over there, doesn't mean then tell me something. Then though I can make the missile from my mobile phone. I can download the thing of how to do missiles and I can make a missile, right? I'm just joking, but that's a fact. So these are the things you have to understand. Or I can make a house also. Being a doctor, I can make a house. I download all these things. How to make a house? Can I do the house?
Yes.
I might make a house, but that could be upside down. You know.
Yeah.
It's a joke.
Yes, doctor. So, doctor, I'll quickly take the last question from our viewers. This person is asking, doctor, during my pregnancy, I was having a severe hair loss, and after my pregnancy, the hair loss was stopped, and then I diagnosed with diabetes. So, is it now again the hair loss has come up? So, is it because of diabetes, or it was because of my pregnancy which I had?
It could be both. In pregnancy, also causes a lot of hair fall. Because you're having two persons in one body, right? You and the person who's coming, right? So it could be, and also triggered by diabetes. So once the delivery is done, I mean, once the baby is being delivered, then you have to go to the diabetes to control the diabetes and go to the skin specialist to reduce your follicle. It's a very common thing. So please tell her there's nothing to be alarmed about.
Okay. She's asking, doctor, when can I visit you?
Where does she stay?
Okay, she answered Kolkata.
You will guide her and she will definitely get the benefit of it. Don't worry about it.
Oh, okay. Thank you so much, doctor. Doctor, would you also like to give us some take-home messages or any other suggestion to our viewers today, please?
Be happy and don't get stressed about things. Leave it to us. Hello?
Yes, doctor. Yes, doctor.
I said, be happy, leave the rest to us, and you'll be fine. Don't get stressed unnecessarily about things. Let the people who handle this stress, let them handle it. And I think it'll be a much better place to stay instead of you getting stressed out and you messing up the whole thing. So just relax and have a nice day.
Thank you so much, doctor. Thank you so much for sharing your expert advice on various issues causing hair problems. And I'm sure our viewers will be benefited by it. And thank you so much for answering all the questions of our viewers. And thank you so much for your valuable time, doctor.
Thank you very much. Same to you. Lovely. It was lovely talking. Thank you.
Thank you,
And
ladies.
have a nice Independence Day.
Yes, doctor. Happy Independence Day. Thank you, ladies and gentlemen, for joining us today. This is Mona Sharma signing off for today. Thank you.